Good morning, colleagues. So Stephen Gunther, Director of Public Health at Walsall Council. And as you might have expected, been rather busy in the last year or so, but this was one of the projects and areas in which I was very keen to support. And within public health, we like to look at our populations, we like to look at actually how can we prevent issues and how can we look to share our information and intelligence. And so when Paul came to me with a suggestion and idea of how we can better safeguard some of our most vulnerable and protect some of our most vulnerable, and also as somebody who, as I'm sure many colleagues have been as well, around trying to explore data and intelligence sharing, and always get stuck with, in some experience, the information governance colleagues around blocking this or putting the safeguards around it, I should say, when your information governance colleagues coming to you, and I would say has an encyclopedic knowledge of the legislation, saying this is a process and a tool in which we can share, look at that intelligence and look from a range of different agencies safely and effectively. I thought, well, why wouldn't I be sponsoring this, and why wouldn't I be pushing this? And this really was a no-brainer for me, just to say, yep, please get on, look at it, let's see what we can do. But also in the back of my mind, well, where else can this lead us? So in terms of what else, and my thinking, and also some of those initial thoughts around what could this do, as we know, with many patches across the West Mids, we've got children, young people, adults who could have been supported if only we'd shared information and intelligence earlier. I've never really come across on the flip side of where we've had reports saying, well, if we had didn't share that intelligence or didn't share that information, we could have done things a lot differently. So in terms of this one, this was really a non-brainer for me. And I suppose what was it, a sort of second point is, what was it going to deliver for me? Well, really it's again purely and simply about better outcomes for our most vulnerable. As I said, I've never seen a report that says this data sharing and intelligence has put people at risk or in danger. It's really the other way around. And again, it's a tool from what I've seen locally, and I'm sure colleagues will share a bit more in the detail, is that real operational conversation. And it starts those conversations about, okay, well, from your perspective, either as a fire or from children's services or from adults or from the health and care sector, what are you seeing as part of this individual and family, and what are your thoughts? And you only always ever see part of the picture. And I won't steal Paul's thunder for later, but some good, sort of real good examples locally of where some colleagues have gone in, seen things, hadn't realised that other agencies have been involved, and it's really started that operational conversation around, okay, well, what should we do? How could we change our support? Do we need to do anything different? And where could we really intervene earlier? And I think what this tool helps and shapes is really those different perspectives and brings those together. The other thing that I've witnessed, again, over the last few months with this is it really starts to help build relationships. As we know, we want to work in multidisciplinary teams, we want to work in localities, we want to work collectively in and around our communities. But again, this provides an opportunity and a platform to enable that conversation. And again, it's really about, okay, well, if we started it here around safeguarding, supporting some of our most vulnerable, where else could we go? And I've always challenged our colleagues around what next. And I think if we think through some of our ambitions around sort of segmenting our populations and thinking about how we can intervene earlier, again, this is a good example and a good safe space and a really important space in which to do this. So just thinking through then what you might want to get out of it, and what benefits does this process help? Well, I think it's quickly seeing things from all different perspectives and doing that early conversation around, okay, well, you've seen X family or X child or X adult from your professional perspective. What other perspectives and what other engagements have other colleagues across the local patch had, and what are your thoughts and what are your ideas? So again, it's really about actually having that earlier conversation collectively from different professional viewpoints, supporting some of our most vulnerable. I suppose the other thing is it's also that assurance system. So again, in a place or an area where we might not be working closely together, it provides that assurance that colleagues are, because sometimes we feel that they don't. So again, it stops that double checking or checking up on colleagues as well. So again, it sort of provides time and space to say, okay, well, we know ex-colleagues have looked at this, we know we're looking at this, actually we're assured that we are having the best interest of those individuals and communities at our heart. And I think also it builds confidence, and it builds confidence in that partnership working, and it also builds confidence in each other. So we don't have to do those sort of double checking bits and pieces as well. I suppose my final reflections and sort of advice about getting this in, and I'm sure colleagues have looked and tried to do sort of data sharing, intelligence sharing before. And again, as I said at the top of sort of my section, that if your information governance lead is coming to you with a possible solution, why wouldn't you be sponsoring this? Because this is a really good opportunity to sort of drive, safely, legally, but also more importantly, to get better outcomes for our people. So context and getting the right people is really important. Also context in making sure partners are cited and engaged. Now, I wouldn't say it's been the easiest of rides, and these things are never the easiest of rides, but again, it's that continued conversation, but also looking at the little wins and re-pushing those back and saying, okay, well, we've had a good result here, what else can we do, and what else can we do, and just keep asking that question, I think. And I think also finally for me is this that sort of practice reassurance piece, that we are got the, and we all do, and sort of we come from different professions, but have those best interests at heart for some of our most vulnerable. So again, it's about that assurance, getting those sort of small little wins and feedbacks, but also in this, it's never an easy ride. So it's about keeping going, and keeping going. So I'm going to pause there, and I think we've got a sort of a bit of a reflection from some questions coming from colleagues. But for me, it's a no-brainer. Also think through in terms of the context in which you're sitting. Are partners engaged and willing and up for this? It also helps in terms of that reassurance with colleagues. And then finally, my final point is it's never easy, and we just have to keep plugging at this. Thank you.